Hey everybody, thanks for being here. Today I'm going to talk about mobility of your rib cage and your thoracic spine. So your thoracic spine is the area that kind of starts at the base of the neck and goes down to the bottom of the rib cage. So foam roller is a really popular tool to work on this area. So that's what I'm going to show you, is some tips and tricks to get the most out of your foam roller for your thoracic mobility. And if you haven't already subscribed to my YouTube channel, please do. It's a great way to keep in touch and to kind of know when I put up more videos, because I'm going to try and do every couple days at least 1 or 2 new videos. So I'm going to keep building my library of simple things that you can do to keep your body feeling good. And it can be support for your yoga program, support for your fitness program, support for recovering and coming back from an injury. So please subscribe. Okay, so foam roller. So I see people doing all kinds of crazy stuff with the foam roller. I'm not going to show you the don'ts. I'm just going to show you what I would recommend. So you sit on the ground with the foam roller behind you, and you'll end up having to figure out exactly where to place it, but you want it to hit you across your upper back. Bend your knees, and then when you lie back, you can adjust the foam roller. As soon as you get there, support your head and your neck. And I'm really interlacing my fingers behind my head and neck. And I like to have people keep their elbows in, okay? If you feel you need to, you kind of lengthen your lower back a little bit. Elbows in just keeps you from hyperextending the shoulders. So once you're here, breathe, and as you exhale, you just lean back. So you want to feel like you're just draping yourself over the roll. Then you would come up and you go to the next spot. So it's like you're going from vertebrae to vertebrae and working on your thoracic mobility. You might find a spot that when you lean back, it's really painful or sharp. If that happens, just come right back up and skip it. And then everybody always says, how high should I go? How low should I go? Once you get to about here, where I'm kind of at the top of the shoulder blades, there's not really a whole lot to do here. You don't really have the right position and leverage. So you can lean back there, and then you would work your way back down. On the lower end, so I kind of rolled way down. Now the roll is at the bottom end of my rib cage. There's a lot more mobility because it's going into my lower back. So you have to judge for yourself and make sure that you're not pinching the lower back. So only go as far as you can go without feeling pain in the lower back and without getting any of those sharp pinches. So again, just working between here and here. You can maybe do 3, 4, 5 spots. Take a breath, lean back. You should be able to breathe. And it's like you're draping yourself over the roll. You're not pushing back, and your hips stay down. So that's self-mobilization, meaning you're mobilizing and stretching out your own joints. The second version I call muscle massage, and it looks like this. Most of you guys have done this one or seen this one. So lean back, same position, support the head and the neck. And then this time you lift your hips up, okay? So now I want to be relatively flat, like head and hips at the same level, and then I'm just rolling back and forth. So it's like being on a big rolling pin, and I'm massaging out my muscles. So both of these methods will stimulate and get your upper back moving, so you'll be a little bit more aware of it when you're doing your neck and shoulder exercises. And then you just come down and come back up. If it's fatiguing to your neck, take breaks, right? You might just do it for a couple seconds and then take a little break. All right, thanks for watching, and stay tuned for more videos on thoracic mobility and also how to integrate that into your exercise programs. Take care.